Welcome to Facts on LGBTQ plus Aging, a presentation developed by SAGE's National Resource Center on LGBTQ plus Aging. We are happy and excited you all have taken the time to learn more about LGBTQ plus older adults. Your willingness to be here is the first step toward creating spaces where LGBTQ plus people feel welcomed and affirmed. Throughout this presentation, you will hear the acronyms LGBT, LGBTQ, and LGBTQ+, or the phrase the community to refer to LGBTQ+ communities. The National Resource Center encourages you to find the language that the LGBTQ+ community and individuals you work with prefer. Today's presentation will last about 20 minutes, and we will have time for discussion and questions. SAGE's National Resource Center on LGBTQ plus Aging is the country's first and only technical assistance resource center aimed at improving the quality of services and supports for LGBTQ plus older adults. The purpose of this presentation is to introduce you to the unique issues that impact LGBTQ plus older adults as they age. It is important to remember that this is not a training. If you are interested in furthering your cultural awareness on LGBTQ plus aging, please visit the SAGE Care Training and Credentialing Program at www.sageusa.care. Before we get started, I want to say that this presentation is a safe space to ask respectful questions. You will be learning about terms and ideas that may be unfamiliar, and the best thing you can do is ask questions along the way. Goals of today's presentation. The first goal of this presentation is to help you understand the unique challenges faced by LGBTQ plus older adults. Lesbian, gay, bisexual, and transgender older adults often face unique challenges, risks, and issues as they age due to their sexual orientation or gender identity. It is important to understand the challenges faced by LGBTQ plus older adults to learn how to best support them in your community or organization. The second goal of this presentation is to help you understand the factors that lead to challenges LGBTQ plus older people. LGBTQ plus older adults may have experienced ongoing discrimination and prejudice throughout their lives, which can lead to accumulating challenges and hardships. These accumulated challenges can have a significant impact on their overall well-being. Understanding how prejudice and discrimination impacts the well-being of LGBTQ plus older adults is an important factor in improving conditions for LGBTQ plus older adults. Today's presentation will consist of 3 parts. First, we will discuss the importance of knowing facts and issues on LGBTQ plus aging. Second, we will spend some time discussing some important issues affecting the LGBTQ plus older adult community. Lastly, we will summarize the presentation with some key thoughts on LGBTQ plus aging. Now, we will discuss the importance of learning the issues affecting the LGBTQ plus older adult community. While it is impossible to know exactly, it is estimated that by 2030 there will be approximately 7 million LGBTQ plus people in the U.S. who are 50 and older. LGBTQ plus older adults are 2 times more likely to live alone, and 4 times less likely to have children. LGBTQ plus older adults are more likely to face poverty, homelessness, and physical and mental health issues. Experience of discrimination and prejudice over the life course can lead to many disparities in older age. Minority stress refers to the stress and challenges that LGBTQ plus individuals face because of societal discrimination and stigmas. Minority stressors are well documented and can have a significant impact on the health and well-being of LGBTQ plus individuals as they age. Understanding how discrimination leads minority stress to disparities for LGBTQ plus older adults is important to make communities more accommodating and supportive places. Now, let's move on to an overview of critical issues for LGBTQ plus older adults. Caregiving is a critical issue, and everyone will either need a caregiver or become a caregiver at some point in their lives. Because LGBTQ plus older people often rely on families of choice, their care networks are often structured differently than those that are non-LGBTQ plus people. 21% of older LGBTQ plus people have provided care to close friends, compared to only 6% of non-LGBTQ plus older adults. LGBTQ people become caregivers at a higher rate than non-LGBTQ people and make up 9% of the caregivers in the United States. LGBTQ people often face a lot of hurdles when it comes to giving and receiving care. For example, laws that favor biological families can make it hard for non-traditional families to get the care they need. Because of lack of recognition, LGBTQ caregivers are more likely to be caring in isolation, which can exacerbate stress and lead to caregiver burnout. Older LGBTQ individuals are much less likely than their non-LGBTQ counterparts to seek help from essential services like senior centers and meal programs. This hesitation to reach out may stem from years of discrimination and harassment, leading many to assume they won't be welcomed in these spaces. Also, many LGBTQ individuals report avoiding medical care because they fear discrimination or mistreatment by healthcare providers. Many LGBT older adults do not disclose their sexual orientation and gender identity because of current and historical experiences of discrimination in healthcare spaces. For example, it's estimated that 40% of gay, lesbian, and bisexual older adults and 46% of transgender individuals choose not to disclose this information. As a result, some LGBTQ older adults may delay or even avoid seeking necessary medical attention, which can put their health at risk. Cultural competency in LGBTQ identities is necessary for healthcare providers and senior service providers to appropriately care for all older adults. For example, 88% of LGBTQ older people say they would feel more comfortable with long-term care services if they knew staff had been specifically trained about the needs of LGBTQ patients. Undergoing cultural competency training is a crucial part of ensuring that LGBTQ older adults can access affirming and comprehensive services, support, and healthcare in their communities. LGBTQ older people came of age at a time when simply being assumed to be LGBTQ or being openly LGBTQ could get them arrested, fired, or worse. LGBTQ older adults have faced discrimination and stigma based on their actual or perceived sexual orientation and gender identity in various ways throughout their lives. For example, 82% of LGBTQ older adults report experiencing at least one instance of victimization, such as threats, harassment, or even physical assault in their lifetimes. Many LGBTQ older adults have experienced discrimination in healthcare settings, including receiving inferior or neglectful care, or even being denied care altogether because of their sexual orientation or gender identity. Repeated experiences of discrimination can lead to long-term negative health outcomes, making it especially important for LGBTQ older adults to have access to comprehensive and affirming care. Ongoing experiences of discrimination and prejudice often lead to what is commonly referred to as minority stress. Minority stress is a well-known problem and has been shown to profoundly impact both mental and physical health. Not surprisingly, LGBTQ older people experience significant health disparities. Because of minority stress experienced over a lifetime, LGBT older adults experience higher rates of substance use, depression, anxiety, high blood pressure, chronic lung disease, and diabetes compared to non-LGBT older adults, younger LGBT adults. For transgender populations, minority stress often occurs in medical settings. For example, 23% transgender people reported that they avoided going to a doctor when they needed to because they feared being mistreated. Cultural competency training for medical providers can be a life-saving intervention for LGBTQ older adults. The LGBTQ community is disproportionately affected by HIV, and this is also true for LGBTQ older adults. Not only are many people with HIV moving into older adulthood, but 17% of all new HIV diagnoses in the US were in people aged 55 and older. In fact, 50% of all Americans living with HIV are over 50 years old. For older adults, being HIV poses special challenges since having HIV is associated with neurocognitive disorders, which can impact memory, motor skills, and cause depression or psychological distress. Neurocognitive disorders are also one of the many reasons that older adults need intensive caregiving from loved ones and chosen family members. It is important for service providers and healthcare institutions to be aware of the significant impact that AIDS and HIV has on older LGBTQ people. While HIV used to be a death sentence, medical advancements and cultural competency mean LGBTQ older adults with HIV can now live long and healthy lives long into their golden years. Secure and stable housing is a cornerstone of wellness but is sadly a major concern for many older adults. Discrimination and bias discrimination can make it more difficult for LGBTQ older people to find safe and affordable housing. For example, in 2014, 48% of same-sex couples experienced adverse treatment when seeking senior housing. Nearly one quarter, or 23% of transgender individuals report having experienced some form of housing discrimination. Due to the lack of protections for LGBTQ people, those that are aging often have experienced unstable housing and a lack of housing resources. Discrimination can have significant and long-lasting effects, impacting access to education, employment, and secure housing. This can create a vicious cycle of disadvantage where individuals are systematically deprived of opportunities and resources that are essential for building a secure financial future. Many LGBTQ older people have experienced these inequities throughout their lifetime. In general, LGBTQ people are poorer and have fewer financial resources than their non-LGBTQ counterparts. As a result of experiencing discrimination throughout their lives, LGBTQ older adults may have lower lifetime earnings and Social Security payments. Additionally, one-third of LGBTQ elders live at or below 200% of the federal poverty level. Difficulties attaining financial security across the life course leads to significant issues in later years, and the unique issues faced by LGBTQ older adults can be exacerbated by financial insecurity. Social connectedness is an important factor in healthy aging, impacting happiness, health, and even lifespan. Unfortunately, LGBTQ older people, who are more likely to live alone and have smaller social networks, and are particularly vulnerable to social isolation. For example, 59% of LGBTQ older people report feeling a lack of companionship and 53% report feeling isolated from others. Loneliness and isolation are associated with poor physical health and have been equated the health risks of prolonged isolation to those of smoking 15 cigarettes a day. Isolation uniquely affects LGBTQ older adults, and 25% of Sage Care Management clients in New York City report having no one to call in case of an emergency. Social isolation is a significant issue that impacts LGBTQ older adults, who might not have the same social connections as people who are non-LGBTQ due to discrimination and prejudice experienced throughout a lifetime. Like all older adults, taking good care of their health is important for LGBTQ older adults. This includes staying physically active, avoiding harmful substances like tobacco and excessive alcohol consumption, and scheduling regular checkups with their doctor. However, it's not just physical health that matters. Mental and emotional well-being are also critical to overall health and should not be overlooked. Unfortunately, being part of a minority group can bring with it a lot of stress that can take a serious toll on both your mental and physical health. Nearly 1 in 3 LGBTQ people smoke, a rate that is more than 50% higher than the general population. LGBTQ older people are significantly more likely to drink alcohol excessively than heterosexual and cisgender older adults. 39% of LGBTQ older adults have had suicidal thoughts, and 2 of every 5 transgender people have attempted suicide in their lifetime. It's important to recognize the impact of minority stress on wellness as a whole and work to address these issues. By addressing these challenges head-on, we can improve the overall health outcomes for LGBTQ older adults. Due to a lifetime of experiencing prejudice and discrimination, LGBTQ older adults may experience minority stress that leads to cumulative disadvantages in their later years. Despite the challenges they face, LGBTQ older people celebrate their identities and have demonstrated remarkable resilience. They have stood up to adversity and have played a vital role in the LGBTQ rights movement. In just a few decades, they have helped bring about significant changes that benefit the entire community. Cultural competency training is key to supporting LGBTQ plus older adults. Encouraging organizations that serve older adults in your community to undergo cultural competency training is an effective way to support LGBTQ plus older adults. This type of training helps ensure that LGBTQ plus older adults feel comfortable asking for help and receive care that is tailored to their unique needs. By promoting inclusion and understanding, we can help create a more welcoming and supportive environment for all older adults. Now we have time to have a discussion surrounding the presentation. I want to ask you all to consider the discussion question. How can you advocate for LGBTQ plus older adults in your community? Feel free to contribute any thoughts, ideas, or questions that come to mind as you consider this question. Are you interested in learning more about LGBTQ plus older adults and how you can better serve those who access your services? Sage Care offers trainings and credentialing for organizations that are looking for more in-depth information on making organizations welcoming for LGBTQ plus older adults. Thank you for your time and attention. If you're interested in becoming a volunteer education ambassador and giving this presentation to members of your own community, you can go to the National Resource Center on LGBTQ plus Aging's website. There are also more trainings pertaining to LGBTQ plus older adults available through the National Resource Center that you can learn about through their website.